Welcome to the President and CEO Focus on the Middle Market podcast series, where President and CEO founder Paul Stukel discusses middle market issues with business leaders from across the nation. Today, Paul speaks with Dr. Keith Kantor, author of What Matters and former chair of a House of Representatives Committee on Healthcare, about the likelihood of Obamacare being fully implemented and its potential impact on middle market companies.
Typically, our experiences and logic would suggest that middle market companies are the ones that usually get wrapped the most by federal regulations, in the sense that they typically don't have the small company exemptions. They're too big for that, but they're not big enough to have armies and armies of lobbyists who are getting exemptions and special deals through legislation, or I guess in this case the seemingly ubiquitous exemptions that the Secretary of HHS is doling out.
Well, if you know Nancy Pelosi, you get them.
Well, precisely. That's exactly right. So anyway, so we focus on that market segment. And it intrigued me when I talked to David. You indicated that you think Obamacare is going to fail because of the way it's being implemented or not being implemented, I guess. And could you expand on that a little bit?
Sure. First of all, you have to remember that the Affordable Care Act, or Obamacare, was not set up to fix the health care crisis in the United States. It was set up politically to try to help with the cost of health care, mostly by regulating insurance and how the businesses interrelate with insurance. But when you do something politically, which is, I guess, how you have to do it in Washington, and you don't look at it from what most of people in business would call normal business logic, it's sort of doomed to fail. It's very hard to just pick little pieces of a huge program and then believe that somehow it's going to fix the entire program. And that's the real problem with Obamacare. He put on these mandates, and then he acts shocked that costs are going up. Well,
yeah.
When you mandate a private business that they have to cover things that they didn't cover before, or not raise rates on certain individuals, they still have to make a profit. They have a business to run and shareholders to that they're accountable to. So they have to raise prices in all the other areas to make up for these mandates. So the most popular mandate is that you have to cover people with pre-existing conditions. Well, that's fine, but how is an insurance company going to afford that if they're not allowed to charge them extra?
Yeah.
So what they do is they raise the rates on everybody. They're trying to hold the rates down on the elderly. Again, very noble. So the insurance company has to raise the rates on younger people, which was always cheaper. And what this is going to do is force more people out of the system instead of putting a lot of people into the system, like was the concept of Obamacare, adding 30 million people to it. And it's tending to have the opposite effect. Prices are rising. They're rising pretty fast. And then one of the big parts of the program, which was the exchanges, they just delayed it for a full year.
Yeah.
So now when a business owner makes the decision to drop insurance and pay the penalty because it's less expensive and it will enable him to stay in business, that decision was based on the fact that the people would be able to go into these exchanges and get cheap insurance.
Yeah.
Well, those exchanges have just been delayed a year, but they didn't delay the other mandates.
Right. Well, it's interesting that some of the primary players in Obamacare, and I'm using Obamacare because it's much easier to say than the Affordable Care Act, and President Obama has embraced that term, so I don't think I'm insulting anybody. Senator Max Baucus, who was basically the guy in charge of writing the thing, has spoken of a coming train wreck because of implementation. A gentleman named Chow, who is the technical implementer of the exchanges, is frightened that there's going to be a third world experience. I mean, this is not terribly encouraging language coming from the folks that are in charge of writing it and in charge of implementing it. Do you really think this is ever going to get implemented at some point?
First of all, it will be implemented, but I don't think it'll work. One of the things that President Obama did is he took $716 billion out of Medicare to help pay for Obamacare. Because if you remember, when it was first introduced, it was revenue neutral, which to me means zero cost. Now the latest price tag is $2.8 trillion over 10 years. I can't fathom how somebody as intelligent as our president is could make a $2.8 trillion math mistake. I just don't believe it. I just believe he's too intelligent for that. So now we have these huge costs, which how are we going to pay for that? We either print money or raise taxes, which is another increase really in health care because we're using tax dollars to pay for it. But besides that, what happened is when he withdrew that money from Medicare, it all came from the fees that went to hospitals and doctors, because that was the politically most expedient method to do it and the most tolerable one. Well, now doctors and hospitals aren't taking Medicare. By January 2014, they say over a third of them will stop taking Medicare. And right now, if you try to get it, most of the doctors will tell you they only will see existing patients. They're not taking any new patients. So what we did is we closed the funnel, and supposedly we're adding 30 million new people. A lot of them will go through the Medicare funnel, and there's 1/3 less health practitioners to see them. So that's going to increase the wait to get an appointment. It's going to increase the wait inside the office, and it'll decrease the time that we actually see the doctor, which right now is usually only a few minutes. Well, that lowers the quality of care, and they may not call it rationing because it's not politically correct. But if you increase the time from, say, a week for a regular appointment with a general practitioner to 3 weeks, and for a specialist from several weeks to several months, that's rationing.
Yeah, sure. Of course it is. Well, in terms of a middle market business, I mean, as a CEO, and given the sort of uncertainty in terms of the timing of implementation of this and actually what's going to be implemented, because they're pulling back on an awful lot of things. I mean, they're pulling back on the long-term care element of this, which they basically said is unworkable, which I'm astonished at. I mean, it's just astonishing, isn't it? I mean, that's a pretty major portion of this.
That was one of the cornerstones of the bill.
Yeah, and now it's unworkable. Surprise. So obviously, there's a great deal of uncertainty as to what's actually going to happen, given the complexity of it and given the very delayed implementation of quite a few things. So, as a middle market CEO, what would you recommend to them in terms of how to prepare for this? Because several of the most recent surveys of these folks indicate that one of their very top concerns is the cost and complexity of implementing this legislation. So it's obviously top of mind to a lot of folks.
Well, what is happening and what will happen is those businesses that are anywhere near the number of 50 employees, which is really below the middle market, will do whatever they can to be below that number so they're not under the Obamacare rules. But
right.
even companies that are bigger will split up into separate companies. If it's a chain of stores, using restaurants as an example, they'll make each one a separate entity, a little more paperwork and a little more CPA type work, but that would allow them to fall under the mandated 50 employees rule.
Yep.
And what the other businesses are going to have to do is they're going to have to weigh the penalty versus the cost. And since they weren't allowed to call it a penalty, based on the Supreme Court decision, and it's legally a tax, the tax is actually very limited. So the mandate for individuals, if you decide not to take insurance, if you're of low economic means, it's $60 a year. Well, that's not enough to force an employee, in my opinion, to get insurance. And if you're a high-income individual, it's only $200 a year.
Right.
And if you were making the decision not to do it, $200 isn't going to stop you. Even from an employer's point of view, the penalty is $2,000 per eligible employee over 30. So if you're in the range of 100 employees, it costs you $140,000 a year. When you compare that to the cost of providing the mandated insurance,
right,
it's small.
Right.
And that's what a lot of employers are going to do. Now, once you get up to several hundred employees or more, then it's a tougher decision. But if you're in the range of 100, even 150 employees, right, the taxes or the penalties are small enough that from a purely business point of view, it's better to pay the tax or the penalty than incur the extra expense and
right,
everything that's involved with it.
Yeah, I mean, I guess, and I mean, certainly from an pure economics perspective, that's true. I guess there is the counter argument that the best firms will use this as a competitive advantage and say, we'll give you great health care. We're not going to force you into these exchanges, and thereby either obtain or retain top quality. But that's a limited activity, it seems to me.
It's a limited activity, and what a lot of firms are doing, and I'm actually part of this, is they're setting up health and wellness programs within their companies. And in many cases, the reason they do it is, of course, to help prevent disease and increase the health benefits of their employees and get them engaged and, like I said, prevent the disease, and that lowers health care costs, depending on the company and what plan you use, between 2 and 9%, and that'll help offset some of the large increases from Obamacare. And what some companies are doing is they're dropping their insurance and just going with a health and wellness benefit platform. The one that I'm associated with is Greenbox Foods, which is a nutritional health and wellness benefit platform. And it shows the people how to exercise, shows them how to eat, helps them plan menus, diets, if they're gluten intolerant, if they have diabetes, gives them a free health assessment, gives them an exercise routine to choose from. It customizes it for them. And this doesn't cost the employees anything, and it costs the employers literally pennies a day to implement this and try to prevent a disease, and while doing that have another benefit to help with their hiring practices, and if they're keeping the insurance, to lower their insurance. And that trend is getting a lot of momentum.
Now, that's interesting, because as I understand it, there's an argument about preventative medicine. No one argues that it's or preventative health activities. No one disagrees that it's the right thing to do. Of course, it's the right thing to do. Making people healthier is a great thing. But there's an argument about the economic results of that from a healthcare perspective. I guess some people say that the cost of preventative medicine or preventative activities is actually higher than your long-term gain in terms of ultimate healthcare costs. But it sounds like if insurance companies are giving you a break because you have these kind of programs, I mean, that's their business. So clearly they believe that the long-term benefit is positive for them. Otherwise, they wouldn't be giving it to you.
That's correct.
Is that fair enough?
Give you some. That's correct. But let me just give you some easy examples. If you sit sedentary at your job for 6.5 hours a day, studies show it's the equivalent of smoking a pack and a half of cigarettes a day. So if you do activities and you engage the employees to move a few minutes every hour, like we do on our program, it takes that one problem away. If employees or just people in general get enough sleep, it reduces stress, which produces all sorts of chemicals, and I don't think you want to go into the details, but I can. And that drastically increases health. If you keep your BMI down, your body mass index down below 30, it lowers your chance of getting diabetes by 200%. So they could say what they want about preventive care, but if you look at my websites, we did a report for Congress called the Blue Ribbon Advisory Panel on Lowering Health Care Costs Without a Mandate, and we showed savings of $253 billion a year over 5 years with no mandate, with just common sense things that literally have no cost. And I'll just give you a few quick examples. Watch the child obesity rate as it's been drastically rising in the United States, and then look when they stopped gym classes in the schools. And for some reason, the diagrams look the exact same.
Mm-hmm.
Now that may not be 100% scientific proof, but I'll go by logic once in a while instead of definite proof. Put the gym classes back in the schools. I had them when I was a kid. Emphasize things like the presidential challenge. We're on the committee for now it's called the Presidential Fitness, Sports, and Nutrition Challenge. We don't do things like that anymore, and that doesn't cost anything because we're already paying at the local level for the schools.
Right.
Teach nutrition in the schools. They have health classes, but the health classes are mostly about sex education. I'm not against sex education, but I think it's even more important for our children to know that an apple is healthier than a cupcake. and
right.
That's not taught anywhere. So little things like that have drastic effects on health care in the United States, since we're basically addicted to sugar, and obesity and diabetes are huge epidemics in this country. And if we could curtail those two, it would have a drastic effect on the cost of health care. So anybody who says that preventative care doesn't work is wrong. Now, the one problem that you have, and that's why you have to pick a good company, is you have to get your employees engaged. You have to get them excited about the program. I don't like the idea of penalizing them to join the program. I like them to join the program because they want to be healthy. They want their families to be healthy. They want to live longer. They want a more energized life. And if you have a good company, a good health and wellness benefit platform that does that, and it gets the employees engaged, it has a almost immediate drastic effect on the cost of health benefits. And like you said, if it didn't, the insurance companies won't give you a discount for doing it.
Yeah, no, that's sort of the proof in the pudding right there. And that's their business. So, well, Doctor, again, thanks very much for talking to me. Just in closing, Where do you see this going? I mean, let's fast forward a couple of years. How do you think this Obamacare situation is going to be? I mean, let's roll to after the 2014 elections. What do you think is going to happen in that period with respect to Obamacare?
I think what's going to happen is Obamacare is not going to work. It's not going to have the effect that it was supposed to, which was reducing costs. But unfortunately, there's clauses in the Obamacare that say if there are no good policies in these exchanges, which have been delayed, the government has a right to issue its own policy, which is a single-payer system, which was unable to pass. And I think either Obamacare will be dismantled and they'll go to some logical system like myself and a bunch of other doctors came up with that the House agreed with, using preventive care, using the tenets espoused by the CDC, don't smoke, eat an all-natural diet with lots of fruits and vegetables, keep your weight down to a BMI below 30, and exercise 3.5 hours a week. And we'll go to making those tenets more a pillar of health care, or we'll, depending on who wins the next group of elections, or we'll end up going to a single-payer system, which is what Obama said he wanted at the beginning.
Yeah, I mean, boy, you hate to be paranoid, but the lack of implementation. I know, but it just begs to be said, doesn't it?
Again, somebody asked me, well, do you know that for a fact? And I said, I'm not drinking buddies with President Obama, but the clauses are in there, and the program's not working, and his biggest backers, I have that article in front of me from the person who helped write the bill, Senator Max Baucus, and he said he sees a huge train wreck coming. And then, you have other people that are doing that. So if that was his plan from the beginning, he's a lot smarter than all of us thought, but it could be implemented because the clauses are there.
Be sure to check back for future editions of the President and CEO Focus on the Middle Market podcast series. Thanks for listening.